Okay, so here we are, 24 hours post-surgery. 23. Yesterday you had teeth removed. You had 10 taken from...
10 from the top, 2 from the bottom so far.
Okay. And yesterday you were basically kind of down and out the whole day. You were able to get a little bit of fluids, drink some kind of protein shakes. Last night we had a little bit of chicken broth.
Yep, and a Gatorade.
Today you've got some mashed potatoes and some scrambled eggs. Those are pretty soft and able to get those down pretty easy.
With the potatoes a little bit, yeah, because it's hard to actually get the eggs.
So a minute ago you called it chicken and taters.
My chicken and taters.
For the day, yeah. That makes sense. So this has been on your bucket list for a while. One of the things that you wanted to do was fix your teeth. And that wasn't a result of alcoholism. That was from...
that was just a result of having bad teeth as a kid. And I had a couple pulled. They were supposed to... They gave me a partial then, and it never...
It just didn't fit right, yeah. So you ended up not having to, or not being able to wear it. And so in some of the other videos that we've posted, you kept mentioning, "Gosh, I hate the way my teeth look." And so one of the things you put on your bucket list was to get this done. And yesterday we went and had that done. You will get to have another set of dentures put in.
The next thing is should be the top implant actually done. So it's not just a denture.
Okay. So for anybody else watching, if you've had teeth removed, and he had a lot, like every tooth in his head was taken out yesterday, so eating is going to be difficult. So things that are easily chewable or easily swallowable, since you can't actually chew, they have a denture plate put in his mouth now so that he has something there, but he can't actually chew. So we got things like yogurts and protein shakes, smoothie type drinks. You've got mashed potatoes that we used a chicken broth, so there's extra protein in it to help make the potatoes soupy.
Yep, and for me it's easier right now keeping I was told I can take the denture out now and rinse whatever. I keep it in right now while I'm eating because I still have a clotting factor that doesn't stop the blood flow as easy as most people because of the cirrhosis. So I figure while I'm eating, just keep it in so I can eat, take it out when I'm done, and then see where it goes.
Awesome. So this is 24 hours past surgery, so we'll end this one and we'll check back in like a couple days and see where we're at and how you're feeling. So enjoy your lunch. They require a face mask. So what is this appointment for?
Liver checkup again.
This is the results of the CT scan?
I believe so. Down a road of addiction and coming out of addiction because I was an alcoholic. So we're kind of recording all the steps that it's taken from quitting to hopefully getting better.
Yeah, absolutely. We'll kind of review all the testing.
We'll keep the video on him if you don't want to be seen.
Okay. All right. So, I think you were seeing, was it 3 months ago or something?
I think it was a little longer than that, actually.
Okay.
But originally, years ago, like literally 3 or 4 years ago, is when they first diagnosed me with the stage 4.
Yes, sir.
And last time I was here, Dr. I ain't gonna pronounce his name right, but he's on there.
Yeah.
Said if I wouldn't have literally quit drinking right then and there, he was surprised I was even sitting here.
Right.
So, must be doing something right.
Yeah. So tell me how you've been. So your last saw Dr. Mufti here 3 months ago in April. Tell me what changes have happened.
Since then, basically just doing like I normally do, go to work, basically full-time job. Unfortunately, the job I'm working at right now is a sit-down job, which I've never been used to. I'm a chef by trade, so I'm constantly moving, going. Job I have now is literally sitting at a desk and I'm putting on the weight. I don't like that. So I'm actually working another part-time job now back in the kitchen, trying to keep myself up, going. I used to work in the nursing field, so they always said once you stop trying is when you go downhill. So just trying to do more and working more. Other than that, since last visit, I sent a message to the doctors here to make sure my blood work was good enough to be able to have some dental work done. Since then, they've actually removed all my top teeth, and hopefully they're going to go back in and do the full implant soon. Right now, I have a denture, but I didn't want to wear it today.
So, in total, they removed 11, 12 teeth?
13. 2 in the bottom and 11 up top.
In one sitting?
Okay. Well, that's a lot.
Yeah.
And it bled for a while.
Are you having pain right now?
I used to. That was the biggest reason of getting rid of the top teeth, was I had pain on both sides. No matter what happened, I couldn't eat. And if I did eat, it was pain to eat. So I was like, well, not like it would show I had a problem eating. I just ate softer foods and donuts.
Right. Okay. All right. So let's kind of review all of your testing so far. Right.
That'll be good.
So you had some labs back in April when you saw Dr. Mufti. It really was to check if there's any underlying cause for like liver cirrhosis, liver disease. And fortunately everything came back pretty negative, saying there wasn't any other underlying liver disease. The reason he ordered repeat testing
just to make sure it doesn't keep getting worse.
Right. So he wanted to check, make sure there wasn't any other underlying reason for any of the abnormalities, such as the elevated globulin level, which that one was just mildly elevated. Sometimes when we see that, it can be anything, right? It can be inflammation from the liver. It can be cancer related, etc. So he just wanted to check that to see if that was potentially part of the reason. And all of that follow-up testing was negative for other etiologies. Okay. So you had an MRI, and your MRI was done to screen for liver cancer, see if there's any there, and or to look at your bile ducts. All of that was normal. No cancer was seen, no abnormalities in the bile ducts.
One thing did.
Yeah, I mean, it did say that the liver was lumpy bumpy or cirrhotic, which of course we know about. It's going to show on imaging. And it did say that there was features of cirrhosis on imaging. Not surprising there. So what I'm trying to understand is how you're doing from a liver symptom perspective. Tell me, are you having any problems with mental status, confusion?
Not that I know of.
Perfect.
Other than I am getting older, I'm in my 40s. I walk into one room to go do something in the kitchen and I forgot what I went in there for.
Okay, yeah.
But that happens to everybody.
Got it.
So,
okay, good.
Other than that, it's like, no, even to the point with the job I'm at now, plus my other part-time job, I'm doing things I've never really ever done in my life. I've never been like what I do work on all day long right now is like reports and stuff like that. Microsoft Word, Excel, spreadsheets, everything else. Never done that before. And I literally just started teaching myself how to do it because people I work with don't know how to do it either.
Wonderful. Okay. Have you noticed, and this is since you were last seen 3 months ago here, any blood and vomit, coughing, any blood?
Only when I had the teeth out.
Okay.
And that was literally because I knew I was going to bleed a little bit more than normal people would anyway. Plus, they didn't do any, when they removed the teeth, they literally just removed all the teeth, put the denture in, and put gauze in and sent me home. Where he's had the same thing done, but they sewn up his. Mine, they just ripped them out, shoved the thing in, and here you go. And I'm like, that don't seem normal, but whatever.
Oh, I see. I'm sorry.
Right now it's still healing, actually, because they said it would take up to 6 months to fully heal.
Okay.
Anyway, so.
Okay. Any blood and stool?
Not that I know of. I have noticed more recently, not blood or anything, but more recently whenever going to work, like back in the kitchen setting where I'm always hot, and I drink a lot of fluids constantly because I carry around a 64-ounce bottle with me just to keep hydrated, that I'm getting a little bit darker output versus the really light output.
Okay.
I kind of contribute that to, one, I'm sweating a lot more, and more of the fluids are getting used that way versus just being expelled.
Okay. So darker urine.
I don't really know, so.
So darker urine
Yeah.
is what I'm hearing. And since when? When did you first notice this?
About a month ago, actually, when I literally after I started this new job.
Okay.
And it's because some days in this new kitchen, it can be 110 degrees or more if the air conditioning is not working.
I work in the same kitchen, and I'm having the same issue.
Okay.
Darker urine,
Okay.
but it's 130 degrees on the line. It gets hot, and you guzzle, and you walk home and you're just dripping.
Okay. But you're trying to. Are you limiting any water intake or no?
No.
Okay.
At least I'm trying not to, but I am also on diuretics,
Yeah, I know.
which are supposed to be helping get rid of some of the fluids.
Right.
That is one of the questions I did have. I wanted to ask is
Sure.
the fact that I've never weighed over 170, 180 pounds typically, and since being diagnosed with the cirrhosis, I quit drinking completely, straight cold turkey. But then my body wanted like sugars, and I'm trying to not eat as many sugars. But is there anything else I can do to try and help? Because we've done all this research on YouTube of what to eat, like cruciferous vegetables, stuff like that, to try and help the liver. Is there anything else to try and, I guess, get the liver to be less fatty, just to help it somehow?
Yeah, so the main diet we recommend is a Mediterranean diet, if you've been able to see that online.
We'll figure it out. We're both chefs.
It's mainly just like lean meats, trying to reduce the reds, the pork, lots of fruits, vegetables, and really cutting the
Lamb.
sweets. That's important too, cutting the sweets from the diet. I know.
That's what he craves, though. Like, since he quit drinking alcohol, it's like this guy never ate donuts before, and all of a sudden, donuts on his brain constantly.
So,
But lately, all of a sudden, it went from donuts to spicy Cheetos.
okay, well,
Spicy Cheetos are better. They're not sweet. They're still a carb, though.
Yeah. So try to limit that the best you can, because all of that, it leads to diabetes and cholesterol abnormalities. So all of that can be factors to consider in the liver, rendering it more fatty. So just kind of things to kind of watch for. That would be the diet we recommend. Okay.
So, and then the hard question I gotta ask is, with all the testing and everything else that is going on now, what is the likelihood I'll have to end up having a transplant at some point?
Good question. So every time you come in, we check labs to determine how well the liver is functioning. And what we use to determine if a patient is in need of a liver transplant is what we call a MELD score. And it's a number that ranges as low as 6 to up in the 40s. The higher the number, the
more likely
you need a transplant, or that you're in the hospital waiting for a transplant at that point. Your last MELD score, I believe, was, let me double check, was 10. So that's actually good.
Great.
It's on the low end.
That's kind of where I've been like, with the one job I work at, we're both getting older, so we're trying to make sure we always have like medical insurance. If not, I'm already paying $3,500 out of pocket just to be able to make payments here to be able to come up and visit. But to make sure we have health insurance and certain things like that, if we don't want to have to spend out a ton, is one, if I'm going to have the liver transplant, you definitely need to have some type of insurance. Otherwise, you're going to be selling your house, pay for that.
Right, sure. That's a lot. That's something to consider for transplant is insurance coverage, being within transplant network for that. So for sure. But yeah, as far as that's a big determinant as far as liver transplant goes.
That's a good thing, though.
So we'll plan to check that today and see what your current notes were, because that was 3 months ago when you were here. Okay.
Yeah, before it was probably actually higher.
Yeah, probably.
Because at one point I was, as he would say, I was yellow. Like yellower than your mask.
Yeah.
And that's literally when they said I had to either quit or soon enough I'd be gone. So I was like, okay.
So that's kind of where he's. We're not expecting to hear you're cured, but 3 years ago he was diagnosed stage 4 liver cirrhosis, which when you look that up is end of life.
Right.
Like you're.
And
So
way
in the last 3 years, we've worked on the never give up, always move forward, improve our lifestyle, and what he's trying to hear or needing to hear is you went from here to here in a better direction versus it's getting worse. But you're definitely on the good side. And if so, how far has he come, and what things does he need to do to continue that path?
Right. I mean, so really just as you're doing, avoiding alcohol, you're doing a wonderful job there.
Well, I had a beer last night.
It's
It was
zero.
Zero alcohol.
Okay. But yeah, no, alcohol really is the best thing, as you know. You've been told before, if you don't stop, your liver's going to stop working. So that's the main thing, implementing a healthy diet and physical activity as best as you can, as tolerable.
Limiting physical activity?
No,
doing more
So like,
physical.
yeah, so like say if the weight today, and I'll examine you, but let's
So
say
the
it's-
new job, which is a lot more physical, is actually a positive?
Yes.
It can be, but really ultimately what we want him to be is health, like within a healthy BMI or weight for his height.
Body mass index. And
Correct.
right now mine is, I got man boobs. I'm not there.
And we'll talk about that here in a minute, okay? But it certainly can be from, if this is fluid he's retaining, why your BMI is higher, or body mass index is higher because of this fluid.
See, and since I've started taking the diuretics, it's kind of not gone anywhere. It's like just stayed.
Okay.
But I contribute that to the fact that I still do crave the sugars,
Right.
which are going to be the fattier content.
Right.
At home, I've been trying to do more of like chicken breast, stuff like that.
Yeah.
Unfortunately, when I go to work, we can get food from the restaurant, but it's basically going to be fried. But if we don't get food from the restaurant, you're bringing in stuff that you can literally microwave, which is not going to be healthy anyway.
Yeah.
So it's like there's not really a hit and miss. It's just either you don't eat anything or you eat junk.
So, your imaging in June, a month ago, can also tell us if there's any concern for ascites or fluid in your belly, and there was not any fluid in your belly, which is all wonderful there. We'll kind of adjust your diuretics. So I'm hearing you're having gynecomastia or breasts. And has that been a long-term issue, or do you feel like that started recently?
Honestly, it's never really been an issue. It just feels like there's more. To say it plainly,
Yeah.
it literally feels like about 6 to 9 months ago, well, probably our last anniversary, when we were in Nebraska, I was like, I feel a little chubbier in this area. And oddly enough, he was joking. He said I needed this training bra because it feels like it literally feels like I'm getting top heavy. Like It's
He's
not
starting-
just a pectoral.
He's starting to get folds on his back as well. Like,
Okay. How long have you been taking spironolactone for? Or aldactone?
Whatever that one is, probably that. I don't know, last 3 to 6 months,
Okay.
or 3 to 4 months. I'm not really sure.
Okay. So.
I know I got put on it before I came up here,
Okay.
and then they had it. They went ahead and refilled it here instead of going to my normal doctor.
Okay.
So it's been a little longer than that 3 months of being up here.
Okay.
So
Do you feel like when you started this medication, you started to notice that around that time frame?
about a month after starting the medication,
Okay.
I haven't really said anything to him, but I felt more like, still weird to say, but my nipples are weird feeling. They like almost tender.
Okay.
Like because whenever I smack up against something, especially working in the kitchen or moving, it feels weird, like tender, and it's like, that's not normal for a guy, or at least not for me, because I'm not used to that.
Okay, the reason I ask is because gynecomastia or male breast development in this medicine is a common side effect.
They put me on boob meds.
So it's really supposed to help with the fluid, but sometimes that can be a side effect.
Because the fact that one, it feels weird as it is,
Okay.
plus I'm noticing that in the mirror. Plain and simple, I'm a guy. I may be gay, but I don't want boobs.
Of course, yeah, no worries. So yeah, let me stop that today. We will switch you to an alternative. It's within the same class of medicines. It's just not like,
Hopefully not giving me boobs.
correct. So it will hopefully take care of that problem. And we'll start you at the very lowest dose of this medication. It's called diplerinone, 25 milligrams once a day. And
And
we'll
then
kind of
basically just cut off which one?
the spironolactone or aldactone, and I'll make a note. I'll make a
is that the diuretic?
One of them.
one of them. You should be on 2. The second one is furosemide, and that is okay to continue for now. But again, let me do my exam today and see how you're doing from a fluid perspective. Okay.
Okay.
We'll also get some labs today. Okay with you? Just to kind of get some updated notes.
More
for.
blood.
I know, and then kind of just go from there. If you start to notice, I would recommend weighing yourself every day in the morning with the same amount of clothing. If you notice like your legs get more puffy or your weight starts to go up 3 to 5 pounds within a day,
I could probably. This isn't the best sock that I usually wear to show it, but
okay,
this here is probably literally, I think, from yesterday's socks.
that's, if I may say, actually not too bad.
I've had my legs have been
Worse.
badder and worse. Yes, when I was still drinking very heavily,
Pull this up.
because I can. Yeah, because that's from the tighter socks I wore yesterday.
It's actually not too bad, honestly. So that means that, the dosage you were on for both the Lasix and spironolactone were actually working in your case. It's a good kind of
Except for
ratio.
giving me boobs.
Of course. So we'll just stop the spironolactone and, switch.
So back to that. I know that can stage 4 go back to stage 3 or stage 2, or are you pretty much at stage 4 always, and you're just working to keep going?
Correct. So once you're diagnosed with stage 4 cirrhosis you're there. Just the goal there is preventing disease progression or the liver from malfunctioning. So just of course, avoiding any other insults to the liver moving forward. So recommend from a liver perspective, immunizing against any vaccinations that you may need, protecting yourself, because say if you're infected with COVID or the flu, that can certainly cause liver damage.
That's one I will not get.
But and I understand, just things that will be recommended if you ever are moved forward with a transplant. they'll have you get screened for everything, colon cancer, have all of your updated screenings completed. So that's just some of the things that you can kind of proactively maybe start getting started on.
We're not there yet.
Not there yet, but
Oh, like I just need to know.
Hopefully we
Like,
won't ever be there, but
correct. Yeah, I mean, for now everything's stable. Okay.
Cool.
All right. Good. All right. Let me finish putting all of the orders in for you.
then we'll go let them be bloodsuckers.
vampire time.
And then as far as imaging, when you should have your next imaging, we can go back to screening for liver cancer. Next imaging will be due in December. So I'll put that future order in and give you a number to call. Okay? All right. Very nice to meet you both. Just wait right here for my nurse and she'll be right in with some instructions, okay?
Yep.
All right. Have a
Thank
good
you.
day. Thank you. Bye.
You're here. And I'll also fax a copy to your primary care doctor. Okay?
Yep.
Any questions?
Which one do I need downstairs? This one?
They already have the ones you need downstairs.
Okay, so
This one is the one you repeat in 1 week.
Okay.
Okay? So if you can tell them, I'll put it when I fax it to make sure they fax the result back to us. But I will, when I fax it, I'll put it in the cover sheet so they will have that information. Okay?
Yep.
All right. I hope you have a great day.
And
And the lady's gonna take you to the consult room.
Okay, thank you.
No problem.
Where do I go now?
She's coming to get you.
Bye. See you next time.